Hello there. First aid, emergency care during disaster management. This is what we will be talking in this video, this very short video. The first aid as a first responder, what you supposed to do. The first person to interact with the victim, what kind of emergency care can you provide? I'll just give you a brief outline, and in the meanwhile, the moment you are giving the emergency cares, please ensure that you are already in touch with the competent people who can handle the victim's problem in a much serious and competent fashion. So let us understand what the first aid and emergency care can be given around it. First and foremost thing, we should be noting the first aid principle, nothing beyond it. We are talking about initial interventions or initial assessment of a person. Describe the component in the nursing assessment of a person. Outline the various steps, what can be done as for the first aid treatment of victims, be it anything that comes around it, cardiopulmonary, choking, shock, hemorrhage, traumatic injury, burn, heat, cold, exposure, poisoning, bites, whatever you feel like, log it and inform it to the other gentlemen, the competent people around it. Pass on the information, because as a first responder, you might not be the right person or the competent people to work upon it, and that needs to be understood time and again. Explain the legal implications of administering the first aid in emergency situation thereby. So the cardinal rule is to remain calm, calm what may, whatever happens to it. Priority is to preserve life and minimize the effect of injuries. Manner in which you conduct yourself can soothe and reassure the victims thereby. Assessment and intervention must be done quickly, effectively, efficiently. Remember, time is of an essence. Treatment is of priority requirement. First and foremost, ask of everything which I'll tell you in this video, but before that, keep in mind you should always inform the competent people. You should always look for it and pass on the message so that competent hands are coming to help the victim in the best possible fashion. Let's say the primary survey looks for a life-threatening injuries. If you look into it, and it might, the person might be choking, there might be blockage in the heart, there might be the eyes might be swollen, the ears they not might not be able to hear it around here, and that is what we need to go around it and find it down. Look for those uncontrolled bleeding, identify the sources, note it down, inform it, pass it down, assess the injuries from head to foot, immobilize the spine, do not shake the person, do not shake the victim. You do not know which bone has been broken or what might go wrong. Look for medical alert, necklace or a bracelet thereby. Splint injury is part of the position that they are found in. The way you find it, ensure that you are not transferring the victim in a different directions. Never change the body. Make sure that the victim is comfortable. In case if he or she is conscious, in case if he or she is unconscious, just do the needful of what tells you on your as a gut feeling, on your common sense, what needs attention. Remember, never to remove the penetrating objects. Prevent chilling, but do not add excessive head. This is what we want to go around here. Do not try to give anything by mouth. Absolutely, these are all no-nos. Remember, I'm trying to help the victim by doing, not doing, since I'm not competent fellow per se. Stay with the injured person until a medical care. The human touch is very important. Remember, a person at the time of emergency will require somebody beside them. That uh, itself helps and augments the person willpower to get well soon. I'll talk about the ABCs: airways, breathing, and circulation. Remember, airways, breathing, and circulation. Watch just for rhythmic breathing. Listen near mouth, nose for ear movement. Palpate the carotid and peripheral pulses thereby. Once respiration and circulation are established, assess for uncontrolled bleeding. And the last one would be shock. So you need to have airways, bleeding, and shock. If none, assess systematic head to toe as what can be going around here. Evaluate the comprehensive thing. Ask patients to follow simple command as to lie down, pick up, want to, whether he or she needs water or not, how dizzy he or she is feeling, or what are the pain points. Now, please ask very simple question and see whether the answer are coherent or incoherent. Inspect the eyes to assess the pupil size, quality, reactions to light. Ask about the neck, pain, stiffness, ability to swallow. Inspect for the chest wall movement, symmetry. Assess breathing, dyspnea. abnormal sound associated with respirations, as in what is happening if the person, the victim, is having difficulties in taking breathing, light palpitations to detect pain and tenderness, inspect the extremities of deformity or injury, and evaluate movement. Assess peripheral pulses and warm and sensation in the extremities as the case might be. Now, what we are talking about cardiopulmonary arrest, absence of heartbeat and respiration causes myocardial infraction, heart failure, electrocutions, drowning, drug overdose, anaphylaxis, asphyxiation. These are things that goes around it. If there are contractions in the heart, difficult to breathe around it. If people are losing their consciousness, signs and symptoms, whether they are collapsing, or they quickly lose consciousness, whether the pulses are coming, going, or there is a heavy sweating by the victim, you can very well understand what is happening. If there are something called anaphylaxis or asphyxiation, froth coming from the mouth, people are incoherent, you will understand there's something called cardiopulmonary arrest. There is heart blockage, or the heart might be paining in a severe fashion, what is known as cardiopulmonary arrest or heart attack. So in such a scenario, you're supposed to do press the chest bone and ensure that you are doing it repeatedly times within a minute. So interventions determine responsiveness, open airways, check for breathing, look, listen, feel, most important. This is very important. Look, listen, feel. If non-responsives and not breathing, palpate for pulse. If the pulse is missing for 10 seconds, begin compression. Ventilation cycle for 30 to 2. If the pulse delivers 10 to 12 rescue per breath, it's okay. If no advanced airway count, continue to 30 to 2 ratio with advanced airway compression of 100 per minute pulses without pausing for ventilation, which are done at 8 to 10 rate per minute. Now, what are we talking about? Cardiopulmonary assist. Two rescuer CPR. One rescuer compresses the chest at the rate of 100. You are pressing it, bones, pressing. Second rescuer ventilate the breathing of 8 to 10 minutes, putting in the mouth and allowing it to ventilate. Swapping roles every 2 minutes to avoid tiring. Recovery position. Unresponsive victim who is breathing should be log roll to one side slowly, ensuring that there are no cervical trauma. If there are any cervical trauma, please do not roll the fellow. Assessment. Universal sign of choking is grabbing the throat with one of the both hand like this. If you want to go around it as if the ear is not going through, this is because the tongue goes back. First, determine if the ear is completely blocked. If the victim is able to speak, breathe, cough with a good air exchange and do nothing. If unable to speak, breathe, cough with a good air exchange. Please do something with good air exchange from mouth to mouth, probably, to ensure that there is no suffocation. This is what exactly happens, just as I showed it to you. And this is the victim out here, if I may say, and this is the first responder. The first responder is holding the victim from the back and probably pressing and ensuring that the blockage has been removed time and again. Choking on the airways obstruction, victims is unconscious, loses consciousness. Lift the jaws and sweep a finger through the mouth to remove any object. Put the finger in the mouth, tilt the head, lift the chin, pinch the nostril, as the case might be. This is the nostril to ventilate breathing from mouth once. If the airways is still obstructed, attempt to ventilate will fail. Reposition the head and attempt once more to ventilate. That is how we need to go around here. This is what exactly we were talking around as far as how to ensure that the victim who has got unconscious should be able to be revived. Shock result from acute circulatory failure caused by inadequate blood volume, and this is how we go around it. It might lead to cardiopulmonary arrest, it might lead to heart attack or heart failure, overwhelming infection, severe allergic reactions, or extreme pain or fright, as the case might be. Hemorrhage, the loss of large amount of blood, loss of more than 1 liter blood in an adult may lead to hypovolemic shock, death of continued uncontrolled bleeding. Bleeding may be external or perhaps internal. Internal bleeding is suspected if the sign of shock, but no external bleeding is evident. What about hemorrhages? When the blood flows is effuses, immediate treatment for any external bleeding is direct continuous pressure. Ensure that the spillage is stopped. Elevate if required. If it is one of the limbs that has been problematic or bleeding has been coming from any of the limbs, elevate the limbs. If you are able to block it out, good. But if not, elevate the ensure that the bleeding stops. After the bleeding stops, secure a large dressing if available over the wound and reinforce the dressing, but do not change it. Why? Because the changing has to be done by a competent medical or paramedical person. If direct wound pressures and elevation fail to control, apply indirect pressures to maintain the artery that supplies that area. Here are the supplies. You know, there is an artery out here, if the pressure points out here, there is a pressure point out here that goes around it, and there is a pressure point out in this position. So if you want to go around here, this is the pressure point that goes around here. So if you can build those pressure points, it helps you all together. Epistaxis, blood from anterior to posterior portion of the nose that comes around here. Most anterior nosebleeds respond to pressure. Instruct the patient to sit down and lean forward. Pitch the nostril. Shut for 10 minutes. Advise patient not to blow a pick at nose for several hours. Continue bleeding up. Bleeding from the posterior area of the nose requires medical treatment. This needs to be understood. This is what has been shown to you. Fractures. What happens in cases of a fracture? It might be a break in the bone. This is the definition of the fracture. But how many kinds of fractures are there? There are 4 kinds of fractures. You remember this thing. Now, what are they? One is a simple or a closed fracture, does not break the skin. It does not break the skin altogether. But compound fractures are broken bones and it protrudes through the skin. It comes out of the skin. You can see the white bone altogether. Complete fracture, bones are broken and are separated. One single bone, one single bone. But now this become 2 single bones. Now this is what needs to be understood. And incomplete fractures, bones are broken, one, 2 single bones. Now there are one bone which has been fragmented into 2, but this time the bones are not separated. Remember, so there are simple fractures, compound fractures, complete fractures, and incomplete fractures per se. Fractures assessment, primary symptom is pain, definite, and there is a swollen also, numbness, tinginess to the nerve injury, blood vessel. Sign is deformity. Why? Because the area swellens up. Discoloration, decrease in function, and bone fragmentation protruding through the skin. That will tell you to you whether there is a fracture or not. Now we'll talk about everything. As in disaster planning, the challenge for the healthcare system is to be ready for any disaster that are waiting to happen, and you never know when it happens. Within a short warning, the American Red Cross and the Salvation Army are experienced in handling such situation and probably move quickly to help. A call for nurse volunteer usually follows. Believe me or not, this is something which I have been stressing it to you from the moment one of this particular video. Regardless of the area of the clinical expertise, there are certain to be in each way a nurse can contribute. You, as they are proficient paramedical staff or a medical staff, as a first responder, you cannot be as efficient as them, no matter how good your intentions are all about it. The last is the legal aspect of the emergency care. The emergency doctrine, in the emergency, person may be unable to consent to care, as in the people will not be able to understand what has actually happened. They might be incoherent, they may not be able to comprehend the situation, or they might be simply too frightened. Treatment can be provided under the assumption that the patient would have consented if able. Good Samaritan law says limit liabilities and provide protection against malpractices claims when the healthcare can provider can render first aid at such scene. These laws do not protect the nurse in the event of gross negligence or willful misconduct. With this, I would love to culminate this particular presentation. Thank you for watching the video till the end.